Good evening. My name is Dr. Doman, and welcome to a special remote edition of Housecall. COVID-19, what effect is it having on Montgomery County? Find out more right now. My guest this evening is Dr. James Bridgers of the Montgomery County Health Department. Dr. Bridgers, welcome to Housecall.
Good evening, and thank you, Dr. Doman, for inviting me to chat with you this evening about COVID-19.
Our pleasure. Unfortunately, because of technical limitations, we're not able to have your visual image during the program, but nonetheless, we look forward to your verbal information shared during our taping. So briefly, Dr. Bridgers, tell our viewers about your professional background.
So thank you, Dr. Doman. Allow me briefly just to share with you some of the many things that I've learned over a 30-year span working in public health and as a retired service member. So I entered the service as a medic, worked for about 15 years as a first responder, military police, chemical, biological, radiologic, and nuclear explosive technician, finally at a command level in the civil affairs and psychological operations branch of the Army at a general staff. I was a command sergeant major. On the professional side in public health, I worked 20 years for a research and evaluation firm in Silver Spring, where I cut my teeth early on in public health with then Surgeon General C. Everett Koop and a lot of his clean indoor air, smoking cessation policy. I worked in HIV/AIDS in the early years, and then the Reauthorization Act of Ryan White. More recently, in the last 6 or 7 years, I served in a similar capacity at Charles County Department of Health as their deputy health officer and acting health officer for a little under a year, where I was involved in similar pandemics and or outbreaks such as Ebola, Zika, avian or bird flu, swine flu, just to name a few. And so I recently joined the Montgomery County Department of Health and Human Services Public Health Services branch a little under a year ago. So happy to be here and happy to support the effort up here and to keep the citizens of Montgomery County safe.
So tell our viewers, what is your current title with the Montgomery County Department of Health?
So my current title with the Montgomery County Department of Health is I serve in the capacity as the Deputy Health Officer to our Chief and Public Health Officer, Dr. Travis Gales.
Great, and let's zoom in then on the topic at hand. Tell our viewers what exactly, as of today, April 1st, is the number of cases nationally in the state of Maryland, and then most important, Montgomery County.
So Dr. Doman, every morning and in the evening, we get our situational report from the Maryland State Department of Health, as well as review the national steps. So currently, as we speak, at 1711 for those military folks and 511 for folks who are now in civilian, there are a total of 186,101 cases in the United States. There are a total of 3,603 deaths throughout 55 reporting jurisdictions in the United States and their territories. So as we dive deeper into those statistics, we get an update every morning at the Maryland Department of Health. And as of this afternoon, there are 1,985 cases of positive cases of COVID-19 in the state of Maryland, with Montgomery County leading all of the 24 jurisdictions with 447 cases.
That's very informative and at the same time very troubling. I should point out to our viewers that there is now a website, montgomerymaryland.gov/COVID-19, that will give you daily updates on these statistics. In any case, let's go on to discuss COVID-19. What are some of the latest data on how COVID-19 presents? Because I'm sure our viewers are worried about that. What are some of the symptoms they should be looking for?
So, Dr. Doman, some of the symptoms that they should be looking for is respiratory distress, trouble breathing, a persistent pain or pressure in their chest, confusion, kind of displacement, bluish lips. Recent reports have indicated that individuals who have tested positive for COVID-19 have lost their sense of smell and their taste. And I read some literature this afternoon that some folks have experienced mild diarrhea and fatigue. And I also have indicated that there are mild symptoms of headache. Normally, when an individual has respiratory distress or a fever of 100.4 and above, 99.4 and above for seniors, they typically should call their providers immediately because now they are experiencing symptoms of COVID-19.
And I should point out to our viewers that as a practicing gastroenterologist, the GI societies have noticed GI physicians nationally that up to 30% now of COVID-19 patients may have bowel complaints. And that often can precede the onset of other more serious symptoms. And still others may have abnormal liver chemistries if laboratory testing is done. So speaking of laboratory testing, let's go on to discuss that. When should somebody who has symptoms that are suggestive of COVID-19, when should they be tested?
So, Dr. Doman, they should contact their provider immediately if they think or are experiencing any of the symptoms that I mentioned. Their provider will go through a screening process to ask those similar questions. And if they feel that they are a candidate to receive a test, they will have them come into their office or come into a designated site. I must also add that if you talk to a provider and you have to either be transported or visit the site or even have our first responders transport you, you should notify the call taker that you are experiencing COVID-like symptoms and be as specific as you can. If it's a persistent cough, if it's difficulty breathing, if you have a fever, because at that particular time, they will provide additional instructions, for example, to don a mask, a protective mask, to not only prevent the spread of the transmission, because it's spread through droplets, through sneeze, through etc., to prevent the transmission, not only from them to you or any transmission in the public domain. Once you get to your provider will administer the test to you. The provider will instruct you to return home, to self-quarantine yourself for 14 days or another period that the provider designates. They will have periodic check-ins and have you communicate with them on a regular basis. Once your test is taken, your test will be sent either to Quest Lab or LabCorp to be tested. Now, the test normally takes about 24 to 48 hours to get the results back. So if you are still experiencing those symptoms, that provider should, in most cases, advise you to go home and to separate yourself as best as possible from other individuals in your house to prevent them from being, prevent you from transmitting the virus to them. So that's pretty much the protocol that CDC has set forth in their guidelines. As you indicated, it's at our Montgomery County website, it's at the Maryland Department of Health website, and it's at the CDC's website as what to do to prevent the spread of COVID-19 if you are sick. Most importantly, you want to stay at home. You want to self-distance yourself. You want to put those practices in place that are come down from either the federal level at CDC or at the state level at the Maryland Department of Health, or even what we are advising folks to do in the community throughout public health services.
So is it correct then that most primary care physicians at this point have access to do the testing on site and then send it off to the commercial labs?
Well, that varies. We don't have a specific count of the number of providers. The providers will let you know if in fact they have the test. They may offer a referral mechanism in place where you could get the tests, but the tests there's a limited number of tests in the community. We are waiting to get more tests in. A majority of the providers have the test, but when you call, they should be able to advise you if the test is available. If the test isn't available, they should be able to provide additional instructions on where to get tested.
Are there any designated testing sites available in Montgomery County?
That's a great question. The individuals should be able to contact their primary care provider. I know that Kaiser Permanente was doing some tests. The local hospital have been doing tests. We've actually been talking here at the Public Health Services to look at drive-through testing. I know that other jurisdictions are doing testing. There is a list of providers that we have that we contact through our disease control to see if they are available to provide the testing. But the key is to call first to see if you meet the testing criteria. Most jurisdictions around are ramping up to do alternate test sites for individuals who may not have access to a provider or individuals who may not be able to get to a urgent care clinic, if you will. So the mechanisms are put in place. One of the challenges that we have is, again, the test. And so we have providers who, through our Military Reserve Corps, who are coming back to support the effort, and other providers who have identified that they are prepared but are waiting for test kits to come, standing by. So we're putting all of this as a plan, but as I indicated earlier, the key is to contact your provider if in fact you're not presenting in an emergency room, which is one of the strategies that we're doing as part of our surge planning to look at other alternative measures to test individuals and also care for individuals.
Briefly tell our viewers at what point, if they're sick and have been designated by their doctors to stay home, at what point should the patient say, well, it's time to go to the hospital? What kind of symptoms warrant going to the emergency room?
So the principal symptoms that are emergency warning signs where an individual should get immediate attention, again, trouble breathing. If you cannot breathe or take a deep breath or walk up a flight of stairs without difficulty, or walk, I would say, maybe 10 to 15 yards, if you have a persistent pain in your chest, if there's a confusion or you have an intense headache, or if you lose a sense of smell or taste, or if you have some gastro problem, diarrhea, those are times that I suggest, strongly encourage folks to contact their providers.
Okay. Well, with that, we're going to pause briefly for a public service announcement. We'll be right back with the special edition of Housecall and COVID-19 here in Montgomery County. We'll be right back.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
We're back with our special remote edition of Housecall, focusing on COVID-19 here in Montgomery County. James, let's go on to discuss the specific hospitals here in Montgomery County and how they've been dealing with COVID-19. Let's go on first to discuss the two Adventist hospitals. How are they coping in terms of their ICU and ER staffing?
So, Dr. Doman, we actually visited, let me just back up. About 3 weeks ago, we had a call with the state and the 6 hospitals and their chief executive officers to talk about our surge planning. We talked about a tiered approach that looked at identifying those individuals, those patients that could be transferred to a suitable facility, those individuals, if we reconfigured one of the hospital areas to accommodate a surge, whether or not we needed to build spaces in that hospital, in the current facility to handle the surge, and then other outside spaces. This is along the time, maybe a couple of weeks ago, our viewers or your viewers saw tents popping up. So that was part of that effort to look at the surge and to do surge planning. All of the hospitals, we visited the Washington Adventist Hospital in Tacoma Park today, and we looked at their infrastructure right now. Since they've been transitioned for about several months now, they were able, based on reconfiguration and restoration in their intensive care unit, they may be able to provide 100 beds as part of the surge. We have a telephone conversation with Suburban Hospital tomorrow. The chief executive.
Before you go to Suburban Hospital,
Sure.
sorry to interrupt.
Sure.
So you're talking about the original Washington Adventist Hospital in Tacoma Park being reopened.
Yes, reopened. That's a tentative plan
Right.
based on our conversation with the state. The state is looking at reopening other hospitals throughout the state and in various jurisdictions where there are a high number of COVID positive cases to handle the surge. So the Washington Adventist Hospital in Tacoma Park has been identified and agreed upon by the area hospitals as a possible surge location.
Are we at a point where you think that is necessary, or are all of the 6 county hospitals, at least for now, comfortably handling the patient population of COVID-19 patients?
Dr. Doman, I would say that they are at a point now where they are managing the cases, but with the anticipated surge happening in the next maybe 3 to 4 weeks, depending upon models, and we've done some modeling as well to kind of help inform our surge planning. But we need to be ready to anticipate a surge if it comes sooner or later. So that's why we're having weekly conversations with the chief executive officers to gauge where they are with their emergency room cases that may present or their influx, so that we can identify whether or not they're at capacity, and if we need to go to alternate sites, such as modeling the tents or the alternative structures to use for testing. So that's pretty much what we're doing. We have a targeted number of beds. We want to be able to, throughout the 6 hospitals, filled or have 500 beds available. So we're working to see how that can be configured and spread equitably across all of the hospitals who've been supporting our surge capacity planning activity.
At least for the current time, it's your sense that all 6 hospitals, ICUs and ERs are handling the current volume of cases comfortably?
I think that they are handling them as comfortably as they can as they come in. But as we see more COVID cases increase, I can anticipate that, and I don't know which particular hospital system will feel the stress. Once we do our epi profile and our geo mapping, we can strategically identify those sites and work within those areas of the county. But as folks become tested, as folks become ill, and as a positive case count increase, there will definitely be a strain in the community.
Okay, let's go on then to discuss in the hospitals the availability of personal protective equipment, PPE. Where do we stand at the current time? Is there adequate equipment for the doctors and staff there?
So currently we have PPE being distributed, but the answer to your question is it's not enough. We just received an indication, and I saw a report online that our national strategic stockpile has been almost depleted, with a lot of the PPE being diverted to the New York area. So we're also planning contingency operations for that. You mentioned the use of PPE. One of the things that we don't want to happen, because PPE is very necessary to not only handling the surge, but managing the number of positive cases that we have presenting now. There's been some discussion about face masks, and I wanted to kind of look at it from a different manner as having not a face mask, because the face mask, the PPE, the N95 masks, the surgical masks are really needed in a healthcare setting. So individuals in the community are making masks, and we thank you for making those masks, but we want to make sure that they are face guards as opposed to masks, because when folks think of masks, they think of the masks that are FDA approved or used in healthcare settings. So I think that's what the CDC may be hesitant to say, using all masks, because with the need and the anticipated surge over the next month or so, folks may pull away from the PPE that we so desperately need in healthcare settings.
Now, given the concerns about PPE availability, of the 445 cases you cited earlier currently identified in Montgomery County, are you aware that any of them are doctors or nurses?
At this particular time, I'm not aware. I know that there was one healthcare professional, but I don't have that data before me. I have the demographic breakdown as far as age appropriate and case count for the demographics. I know one of the priority test settings as we look at testing, and also not only PPE, is that we want to make sure that our first responders have adequate supply of PPE. So here at the health department, we have prioritized our healthcare professionals, our first responders, those symptomatic and asymptomatic, and individuals with underlying conditions, to look at a realistic assessment of what PPE we need. And so it's very challenging in that there are multiple settings that require PPE, and with an increased number of cases, we are seriously at risk if we don't ensure that those individuals who are in need and who respond to the epidemic, or the pandemic, I should say, have access to that PPE.
Let's go on to discuss ventilators. How are each of the 6 hospitals currently supplied, and do you anticipate a shortfall?
Right now, as we met this morning, the Department of Health and Human Services and MEMA are working with multiple partners to develop standards of care and to get PPE in. There's a shortage of PPE in the area right now, and I will have a better assessment when we reconvene our meeting with the 6 area hospitals and their CEOs to see exactly the number of ventilators that we need to enhance or include in our surge planning. We've been talking with the state daily as far as looking at other resources and other individuals where we could possibly purchase ventilators to support our area hospitals, as well as our surge planning. But just like the PPE, the ventilators are a high commodity. And again, a lot of the medical equipment and personal protective equipment have been diverted to stem and reduce the number of deaths and positive folks in the New York City region.
One important quick question. Given that we're surrounded by multiple excellent medical centers and university centers, such as George Washington University, Georgetown, Johns Hopkins, University of Maryland, and of course NIH, are you aware of any nearby clinical trials for COVID-19?
At this particular point, I am not aware of any clinical trials. There's been some discussion about various supportive treatment or other drugs to treat malaria, but there's been no definitive indication given to us that there's a clinical trials other than what we may see or receive from CDC or NIH. And the other universities, we have engaged their research scientists to help with our mapping to identify case-specific areas that we can target our strategy to prevent the spread. But Dr. Doman, let me go back because I have some information here. Thinking about ventilators and PPE, we've had individuals contact us about donating PPE and procuring additional information. So if any of your viewers have any suggestions, they can reach out to procure, Procure, at montgomerycountymaryland.gov. And we're soliciting invitations and requests for not only PPE, but for ventilators if they're selling or donating emergency equipment. And that will help us ramp up and distribute those equipment and PPE throughout the community to not only handle the surge, but also support our area hospitals if there's a need.
Very good. We will certainly pass on that word. We've got 30 seconds left before we have to close. Very quickly tell our viewers what your thoughts are about the value of hand washing, home quarantine, mask, and social distancing to prevent the spread of this infection.
That's a great way to end our session, Dr. Doman. Hand washing is paramount. I know that some of the guidance from CDC and abroad indicate that, hand sanitizer is good if there's 60% or more alcohol in it. Hand washing is the key. I make it a practice as I go out. At any point I leave my house, if I'm in the Incident Command Center here in downtown Silver Spring, we encourage folks to scrub in and scrub out, wash their hands. Social distancing is another key strategy to lessen the curve and present. The stay-at-home directive was needed, in my opinion, because folks were not practicing social distancing. The virus is transmitted in close contact. Close contact is defined between 2 to 3 feet. And so if you can maintain that social distance.
Thank you for your information. Unfortunately, we have to close. You've been a terrific guest.
Thank you, Dr. Doman.
So my thanks to Dr. James Bridgers from the Montgomery County Health Department. My thanks to my terrific team at the studio for making this remote program happen. And my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. I know it's been a very stressful time for all of us with home quarantine and being virtually inundated with 24/7 bad news about this pandemic. I want to remind you and shout out to my colleagues in the medical community, the dedicated doctors, nurses, and first responders who are here for you, who will treat COVID-19, whether it's in a hospital setting, an office setting, or in your homes. Please remember that we are here for you, that you're not alone. So let me close by saying, be strong and be safe. Thank you all for joining us for this special edition of Housecall. See you next time. Good night.